Good morning, Supervisor McDonough and Baker. Can you hear me?
Yes, good morning.
Good morning.
Good morning, Supervisor Baker. We hear you as well.
Okay. All right. Let me get launched here. All righty. We will convene the Dubuque County Board of Supervisors meeting Wednesday, May 20th, 2020, 10 a.m. And on the agenda, we have an update. Before we do that, so we don't forget, we usually do it at the end. I'm going to just remind everybody that next week, our normal Monday meeting is moved to Tuesday, and it's an evening meeting. I'm assuming we'll have work sessions prior to that. But the question was brought up to me today, are we going to meet Tuesday night and then turn around again and meet Wednesday morning? So I think that's something we should think about, and then at the end of this meeting, decide our schedule for next week. So, all right, we'll start with the agenda. First thing on the agenda is the update from the County Emergency Response Team on COVID-19. I would defer to Patrice Lambert and Tom Berger.
Good morning, this is Patrice Lambert, and I believe that Tom has a conflict right at 10 o'clock, but he may be joining us. And I do know that Stacy Killian is also on when we get to the COVID-19 testing update. She will help me share our progress with the testing in the county for this week. So for an update from the Incident Command or the Incident Management Command Team with those two, as well as Mary Rose Corrigan and myself, I just wanted to share that we do have some new information to share with the county residents on how you can look at our status report, our COVID-19 status report. And we just kicked this off this week, or just presented it this week, and we're going to attempt to update this on a daily basis. Now, we don't know if we'll have a link on our website that people can click on to get the most up-to-date information from this, but it's basically, we're looking at a 3-sheet type of information status report. The first sheet will just give the basics. It'll list how many hospital beds we have, the number of ICU beds, and this is all county-specific information. And then we did add some insurance information for the county residents, and it does have the race, the ethnicity, and the age, and that will all be on the front page. And just probably the bottom of that page will change on a daily basis. No, I don't even think that all of the bottom will. It'll just be the cases that we've had from the previous day. That will probably be the only factor on that first page that will change on a regular basis. And then if you look at the second page, we did go ahead and formulate a Dubuque County epi curve. So we're hoping to keep this updated again on a daily basis so that you will see how our cases increase. And then the solid line that goes through is the trend line. You can see that our cases continue to increase in Dubuque County. Now this, I believe, was done on Monday, and I do not have the updated one from yesterday. So we'll try, and I know Randy Gale is going to put the link in all of his updates that he does put out every single day. And then if you look at the third page, it's just a map, a picture of the map of Iowa with all of the counties listed and the cases that they have in each of those counties. So I just wanted to basically share that was just new information that we're hoping.
For Patrice Lambert, and we will be coming back to this agenda item when Tom Berger comes back on. So Yeah, and I'll be notified by Dawn when Tom gets in the meeting. So, all right, I'm going to virtually turn the gavel over to Tom Beschen, the chair of the Dubuque County Board of Health. And so we're into the next item on the agenda, which is Board of Health update. Chair Beschen, it's all yours.
Thank you, Chair Baker. I would start the meeting by indicating that we have 4 members of the Board of Health on the call. We will be able to discuss. We will not be able to take action unless a 5th member joins us. So with that, I would turn it over to Stacy Killian for an update on the COVID-19 testing.
Sure. Hi, everybody. So, as you know, BNA started doing some on-site testing this week at our current location. We are focusing on those being identified through contact tracing. So anyone that might have been in contact with someone who was positive, we worked with the Incident Command Center to contact those that might work inside residential independent living facilities, some local law enforcement, and I think I got them all. Patrice, did I miss any?
No, you got them all.
Oh, and actually, and we did expand to some of those that are working like in the food pantries, the shelters, some of those more high risk out in the public. So we did offer testing as well as there. So we started our testing on Monday, and we are running every day this week through Friday. On Monday, we tested 65 individuals, and then Tuesday we tested 173. So we definitely jumped up on Tuesday. Monday was a little slow. So far to date, we've tested 238 individuals. And judging from the way my parking lot looks this morning, we're probably going to hit some high numbers again today as well.
And then I can also add that we did work with 2 of our residential homes, and they have a nurse on site, so we did provide them with a collection kit, and they're doing their own testing. So that pretty much will be completed. If it didn't get completed last night with those 2 residential homes, it will be completed today as well. So that'll bring our numbers up to, I believe, right around 300, maybe a little bit more from those 2 facilities. So we're on a good path to reach. We're hoping to reach 1,000 with the testing this week, and at this rate, I think we probably will. So that's a good thing for us. And I can also add, I'm sorry, Stacy, are you finished?
No, please go ahead, Patrice.
Okay. I can also add that I have been in conversation with the Iowa Department of Public Health and the state again this week already, looking at the possibility of obtaining additional free collection kits and having the testing done free of charge for Dubuque County. We did, as you know, last week requested the 6,000, but I have actually told the state and IDPH that if they have specific criteria set up for us and that it only turns out to be 1,000 a week or whatever, that we, again, will do everything that we can do to accommodate whatever their criteria is, with the testing collection kits and the testing process still being free of charge. We have been in contact with the long-term healthcare facilities that they have gotten a new directive to test their residents. And I have been in conversation actually last evening with IDPH to see if they could provide us with those collection kits free of charge, so we can get those to long-term care to have the residents tested this time around, because we did all of the staff 2 weeks ago. And I have not heard back if it's a possibility that we can facilitate that process, or if IDPH has another system set up that they're going to go statewide. So I'll keep everyone informed of that component as well.
Okay. Anything else from Patrice or Stacy on the testing update?
I do have I have a question, Tom, if I may.
Yeah.
I usually try to not have input during the Board of Health meetings, but I have a question that was brought to me by family members of folks in a care, who have loved ones in a long-term care facility, where they indicated that there was one positive.
That did not participate, and that was either based on their medical director advice or else it was their policy statement. Now, the one that had a policy statement, they were attempting to change that with their corporation because that allowed, well, basically the message was similar to that if anyone was tested, then they had to remain out of the facility until the results came back in. So they were trying to change that verbiage with a corporation. So it was the verbiage in their policy. But the others, their medical director had advised them not to be tested. So yes, and I will not name the facilities, but yes, there were a couple that did not participate.
Okay, thank you.
And I would just recommend if I truly understand where the resident's family is coming from, I would just encourage them to contact the administrator of that long-term care and talk to that person.
Patrice, this is Diane Pape-Freiberger. I totally agree with if the state will send us collection kits and if they're for free, that we should use those first. But also from a county standpoint, we do have the availability of increasing testing, even if our Department of Public Health or the state does not send us those collection kits. So I do agree with to get the answer back from the state first, and to send in the collection kits and to run them for free. But we also have the availability at the county level to test others with collection kits from United Clinical Labs.
And Diane, I don't know what the skill set would be for the long-term care nurses to be doing the oral pharyngeal swabs. And I don't know how, right now, even if we had the 1,800 available at a cost of $147, I don't know how, if the county would pick that up or if we would have to charge the long-term care. Yeah, so there's a lot of logistics that would have to be looked into, Diane. But yes, we always know that those are there. But again, if we can obtain the collection kits and the testing processing free of charge, to me, that I would fully go with going the no-cost route versus the cost. But yes, we do know that those are available. So thank you.
Well, I mean, just a comment here is that we don't know the answer yet, from the state. And we addressed this several weeks ago, what the skill set would be, needed for nurses to perform this oropharyngeal test versus anterior nasal swab. There is a difference. Whether the nurses within those facilities would be able to do it or not, it is another question. But I guess that would be a question also to pose to Stacy, is if DNA would be available, or would they be able to handle the workload to do that if they needed to, rather than individuals coming directly to them at the DNA site, if they went and offered some support to these nursing staff within these facilities to be able to do that. The other question that I have is with the payment of the test collection kits that are going to be utilized through United Clinical Labs. We also have the availability to request insurance payment for those because, according to the Senator Grassley, Senator Ernst, and Representative Abby Finkenauer, we had received communication back that all of those will be covered. that the federal government has said that all tests should be covered. I see that it's easier logistics-wise to do it if the state is willing to pay, but if we need to apply for insurance payment on those, or if there are some that do not have insurance, for them to utilize Crescent to be able to obtain those testing. And thank you, and Stacy, and all of the BNA, and all that you are doing, because I know that there's a lot of work that's involved with this. Thank you.
This is Diane Heiken. Patrice and Stacy, I had a question, and I apologize. My computer kicked me out, and it took me a little bit to get back on, so you may have talked about it. But in regards to Dubuque specialty care, I wondered if one of you could clarify the number of patients and number of employees, because I have different numbers down than somebody told me were reported in the paper. I have 80 patients, 65 employees. Is that correct?
Diane, I don't have that in front of me right now. I'm trying to pull it up. Stacy, are you aware?
This is Tom Eschen. That's a number that was reported at a previous meeting as far as, I don't know whether it was 80 staff and 65 patients, but that 80 and 65 is a number I had heard as well.
Okay, I just wanted to clarify that. Someone told me a different combination, 60 patients, 85 employees. Just I'm keeping track of, the percentage, and without having the actual numbers in front of me, I wasn't sure. And then I just wanted to clarify with Stacy, I think you would be the best person. Their testing is going on independent of anything you're doing this week. It's not part of the 1,000. That's something that you continue to work with them on a daily basis and contact them. Is that correct?
Correct. So I do talk with them every day. And I also talk with Iowa Department of Public Health just to provide as much assistance as we can. And any testing that they're doing is separate from the 1,000 that we are doing this week.
Okay, thank you.
You bet.
This is Dave Baker, Chair Besh. I'm sorry to butt in, but Stacy, if you could, I don't know if you're away from your mic. It's a little muffled. I don't know if anybody else is having trouble hearing Stacy.
Is this better?
Yes, much. Thank you.
You bet.
Could you maybe repeat what you said, Stacy, so that people could hear how you're updating with them?
Sure. So I am working with the administrator at Dubuque Specialty Care, Brooke. I talk with her every day. I'm also talking multiple times in the week with Iowa Department of Public Health, just providing any assistance that I can. I know that we've provided assistance on staffing, testing. I know Tom Berger, and he's not on, but I know he has been working with them on any PPE needs to make sure they have what they need. So we are in pretty good contact. And any testing that's being done at that facility is separate from the testing that we're doing this week.
Stacy, this is Diane Pape-Freiberger. That testing, who's being tested, both residents and staff? And we had, to my knowledge, they had been tested 3 weeks ago tomorrow. It completed 3 weeks ago tomorrow. So are these same individuals being retested?
There are individuals that are being retested more than once. So yes, and it is both. They're doing it for residents and staff as well.
So this is Diane Heiken. So that testing can be characterized as like a rolling process. It's not a one and done. It's being addressed on a PRN or an as needed basis. Is that correct?
Yes, they're working with their medical director and on the recommendations from their medical director and with Iowa Department of Public Health. So that testing is rolling and not just a one and walk away.
So Stacy, can you clarify with me, I know that you've been in direct contact with the administrator. Has she expressed any need for support staff from the state or from other facilities to be able to support if they have a high number of staff that would be sick, or whether the residents are needing more care?
Yes, and so we have talked with her about that. And Patrice and I were able to get a list of, so the state is collecting what's called an iServe, and it's individuals in and around our area that are willing to work in the long-term care setting as needed. We provided that list to her this past week, so she had it and was able to tap into additional people for additional staff as needed.
Thank you. I appreciate that.
You bet.
Okay, this is Tom Beshin. I see we have a raised hand. Mary Brimmeyer would like to address the board. I assume this is regarding testing. So let's see if I can unmute you. Mary, you are...
Yes, my mom is a resident at Dubuque Specialty Care, and the email that we received, the latest email we received from Brooke Benz from the facility is after receiving the resident results of the COVID-19 test from the entire building, we have 40 positive cases for residents and 9 employees. We received the test for employees to get tested today and will be coming up with a plan on how to test everyone. That was sent 2 days ago. That was the update that we received. That's the latest one that we received.
Okay. Thank you, Mary. I believe that was also reported in the Telegraph Herald yesterday morning. Okay. Thank you. Anything else regarding testing?
Tom, I have something, Dave Baker here. I'm taking it right off a chat, and I think there's 2 questions that I can put into one. First part of it would be, the question was raised, did not the county already agree to pay for testing that the state will not cover? I think they're referring to a motion that the Board of Health made, so I think they've got their organizations mixed up a little bit, but so I'll let the Board of Health talk about that. And then, let's see, the other part of it was, is the county's position that they will only do testing that the state approves so that the state will pay for it. So it's kind of a 2-parter. So I'll throw that over to the Board of Health.
Well, this is Patrice, and I can identify the second component of that, and that being that we have always asked with their criteria, the state of Iowa criteria, to be able to continue to bring in our contact tracing population. So that to us is one of our priority groups, and the state has never denied being able to bring in our contact tracing. So with that answer, I would say that they are flexible. Even though they give us the initial criteria, we are able then to add, and such as this week, we were able to add the law enforcement to be tested as well. We were looking at our essential populations, that being one of them. We started with Joe Kennedy with the jail component, and then we branched out to the city and all of the towns and the county law enforcement. So my answer to that is that even though they do give us criteria, they are willing to hear our concerns with the testing population as well.
Tom Beshin, there's an individual with a hand raised on the screen.
Well, we haven't dealt with the second question yet.
Okay, he had it raised before that, so.
I am looking at the 29 or 40 participants, and I don't see a hand raised. I did see a hand raised before from Mary Grimmeyer. That is no longer up.
Tom, it's not the digital hand raise. Steve Freeze is actually waving his hand in the picture, so he doesn't know about the button that I can't ever find either. So he's just waving.
And Chair Beshin, I have messaged Mr. Freeze that we would give him the opportunity to speak. But if now's that time, if you want to do that, feel free to go ahead and let him speak.
Let's see, if I can find.
Don
there.
Sherman will take care of it.
Okay. Don, would you unmute Steve? I tried, but I can't.
Did that work?
There you go.
Thank you. I'm more than happy to wait until the answer of the second question, but I do really want to talk about the testing and the challenges within Dubuque Specialty Care, because my mother is one of the residents there that has tested positive. So to keep the flow going, I'd be happy to let you get the second answer, and then if you would come back to me.
Okay. All right. The second question was, had Dubuque County agreed to pay for any testing that the state wouldn't cover? I don't recall that motion and being made and approved by the Board of Health. Does anyone else on the Board of Health recall that? We agreed to purchase more test kits from United Clinical Labs, but I don't think there was a statement made that we would pay for anything the state doesn't cover.
Tom, back on April 8th, Board of Health combined with Board of Supervisors meeting, we carried a motion 6-0 that we would use COVID-19 funds if needed to be able to test more individuals in Dubuque County. That should be recorded. Diane Heiken has listened to it since then. I did not go back, but it was April 8th that we made that motion carried 6-0.
Okay, I thought that motion was clarified to use that money to purchase additional test kits. At that point, we had no information on the $147.
That is correct.
So
the number is down to 126 now, but that's still a cost if we're doing 6,000. And I think, Tom, just a comment on that. The testing, there's no additional cost for United Clinical Labs to, in addition to that $126 or whatever the number is going to be by the time we get around to this. There is no additional cost other than we may need to support DNA to be able to go into these long-term care facilities if that's where the population is, or into shelters or wherever. You know, if that should be the only additional cost would be to the support staff. There would not be an additional cost above the cost of the test collection kit. Just a comment.
Okay, thank you. Other board members, where do you feel this lies? Todd, Diane Heiken?
This is Diane Heiken, Tom. I don't think the language in the motion that was we were going to pay for testing that the state will not cover. I think it was to secure more collection kits. I think it was to ramp up testing, but I think we've been able to do that so far through the initiative that Patrice and Stacy are doing. I think we are continuing to look to the future for some long-term testing. And as gaps are made aware, or as we are made aware of gaps, we've been trying to address those as well.
Okay.
And some of those are being addressed this week for some specific individuals. So I don't remember that language that we were paying for testing that the state will not cover.
Okay. Well, all right. Thank you, Diane. What I will do is add that as an agenda item for our next meeting, which will be Tuesday night, because we do need a quorum to address that if the Board of Health is going to approve the appropriation of those funds from the monies set out by the Board of Supervisors. Okay, Steve, I will turn it back to you if you've got some comments.
Can you hear me okay?
Yes.
Thank you. I'd like to thank the Board of Health and the Board of Supervisors for the opportunity to talk with you this morning. My mom is 93. She is in the Dubuque Specialty Care, and it's really been a challenge for us, for the ability to get testing done in the first place. And I can appreciate the cost of this. I was in state and county government for a long time, and I know you have to balance the budget and all of those components of it. The federal government is telling us that, there will be dollars available to pay for these tests, whether it's through FEMA or whatever other mechanism. And my advice to the Board of Health and the Board of Supervisors is we have to get ahead of this pandemic. We were first notified that there was a positive test at the facility on April 22nd. And my sister asked the simple question was mom in contact with either the patient or the staff members that have both tested positive at this point? And they were doing contact tracing, which is very appropriate. But to date, they have never been willing to tell us if she was in contact with them. I don't know a single other resident in the facility. There is no way HIPAA would have been violated in this instance. We just needed to simply know if she had been in contact so we could have considered in a timely fashion of taking her out and bringing her back to one of our homes to protect her from this outbreak. But to date, almost 2 days shy of a month, we have still not been told. Obviously, she has been in contact because she now tests positive for COVID-19. So we worked really hard to try to get this done. I called my state representative in Wisconsin. I can see Dubuque from my farm, so I'm right on the river. And we called our state rep to ask for help. He called Representative Eisenhart in Dubuque, and you all then went into action and did the testing of the entire facility. There's a long lead time for this to come back. It was 3 days from the point when the test was done until we got the results. And on the day we got the results, mom started showing symptoms. Now, you should not rely only on the temperature above the 100 degrees as the result, because in mom's case, it was extreme fatigue, pink eye, loss of appetite, diarrhea, and extensive coughing. All of the classic symptoms except for the temperature. Now, she's been retested as a result of her medical doctor, not in the facility, doing a telemedicine update with my sister, and she thought mom had all the symptoms of having the COVID-19. So she was retested and came back positive. So how many people was she exposing because she didn't have the one symptom that everybody's relying on for determining if they have COVID-19? You should change that protocol. If they've got 5 symptoms but not the temperature, you should be looking at that. Otherwise, we'll never get this under control, and that's my concern. This is not just a one and done. Once summer gets here, this is over. When I was in the state legislature in 2003, I served on the Public Health Committee. And there, as you will remember, there was a SARS outbreak. And in Wisconsin, we were regularly briefed. The committee was regularly briefed on what to expect and how to prepare for this. And I suspect that happened in all the other states as well. So it didn't develop then, but everything they told us in 2003 is now unfolding before our eyes in 2020. So I'm hoping that we can learn from this because, we might get this under control now, but there's evidence that maybe people are being reinfected and there's a different strain of it. So this is not going to go away for us, and we should not be concerned about the cost of the testing if the federal government, whether it's through FEMA or whatever, says they're going to help pay for this. We need to get ahead of this pandemic, and the victims who are helpless are like my mother, who are trapped in a facility that has been under quarantine since March 11th. I haven't been able to go see her since March 10th. I've been Skyping with her regularly to try to keep up on this, and that's why we saw the symptoms. And, you just can't abandon these folks. Despite the fact that she's 93, she's got a long life ahead of her, I suspect. And so do other residents there, and we need to protect them. And you are the individuals who have the ability to make that happen. So don't just look at what this is going to cost in terms of per test kit, because look what it's doing to our national economy, our local economy. And I mean, you have a large loss of life in these facilities as it's happening across the country. You're going to have the viability of them being able to stay open because of the diminished population. And that will not be good for all of us when we need a place to care for our elderly parents. So I appreciate your ability to listen to me, but just recognize that you're at the front line here and you need to step in and help because this may come back and I may be talking to you in December again.
Chair Beshan, if I might, I have specific questions for Mr. Freeze, and those are, what is it that this Board of Health has failed to do? And also, I need to have clarification from Stacy Killian and Patrice Lambert to answer this family's questions again about what's happening at the state level with regard to Dubuque specialty care.
So my answer would be is that from what it appears, that there was no one from the Department of Health that went in and oversaw the response that was on the ground in the facility, that they were following the CDC guidelines. I mean, I'll have my sister Mary Bremeyer fill you in on some of the details that we've seen that they weren't wearing when we were Skyping. They weren't wearing masks, they weren't wearing gloves, you know, and when the isolation wing happened, they still were not using the exterior exit to do all of the restroom, the food, all of that. It was all going through the interior and the common space.
Sir, you're explaining what happened at the facility. I'm asking you what happened with regard to the Board of Health. And I'd ask my Board of Health members to make sure you're aware of any failings that we have done.
So did you send in people to monitor this, to make sure that the proper protocols were going in place? What was the policy for providing test kits? I mean, from what it appears, there had to be 3 on the outbreak before it was even a consideration. And so from an infectious disease standpoint, whether it's COVID-19 or SARS or something else, when you have one individual who has a highly infectious disease, what was the action of the Board of Health or your staff?
Okay, and
to go in and do that. So that we don't know that because
this is our chance to ask Stacy Killian and Patrice Lambert, Executive Director of our Health Department, to answer the family's questions. I guess it's a critical question that we need to know. How does the Board of Health and our health team work with an individual facility? Could somebody explain that, please?
Stacy, go ahead, Stacy.
I'll start and then you can jump in.
We can't hear Stacy.
Can't hear her.
Sorry, can you hear me now better? I pulled my mic closer. Is that better?
Yes, and please, thank you, Stacy. Please just take your time.
Okay. So I can give you my role within this facility and what our agency has done, and then Patrice and anyone from the Board of Health can add on to that. So originally, Iowa Department of Public Health contacted the VNA and asked that we would have a conference call with this facility at the start of the COVID outbreak. We sat down with them on a conference call, discussed staffing plans, contingency plans, isolation opportunities within the facility. Iowa Department of Public Health worked with them on what opportunities they had to isolate residents within their facility and what needs do they have both on a local and a state level to achieve that. Since then, when we identified that more positives in that facility, we helped facilitate getting the testing kits directly to that facility for both residents and staff. We assisted in making sure that was completed. The facility is in constant contact with both Iowa Department of Public Health and myself on the number tested, who is positive, who is negative. And so I have been following up since then, every day, checking in. Do they have all the PPE they need? Is there additional assistance or additional policies that we can provide or help to make things safer within the facility? What needs do they have there? I've personally spoken to their corporate office and their administrator, Brooke, multiple times. Tom Berger has given them all the PPE that they have requested, and it continues to work with them closely on that. And Iowa Department of Public Health, Amanda Casson, talks to them routinely, ensuring that if they need additional testing kits, as I stated earlier, multiple people in the facility have been tested multiple times. And any testing kits that are needed or that have been requested by the facility has been given per Iowa Department of Public Health. So my role is a support role with them, is checking in every day, finding out what they need, what we can do to help, both on a local and on an advocacy level with the state. Recently, they requested additional assistance for staffing. We provided them with a list of anyone available in the area that could potentially assist them. We got that to them, and I personally am the one that talked with Brooke about that, so she was going to look at additional staffing. So for my role, that's what we've done with this facility. And Patrice, I don't know if you want to add on to that.
I just have a couple of things, but no, you covered it very well, Stacy. Thank you. Right from the very beginning, I believe it was probably even the first day, Stacy and I did have a conference call, as she had said, with the corporate operations down, I believe it's in West Des Moines. It's in the center of the state, and Brooke and the director of nurses as well. And we did state the protocol that Stacy would be making daily contacts with them, which she has been. I do know, too, that with the state, they are making daily contacts with the facility as well. And if Stacy, she is our contact person with the Instant Command team. So if she has any concerns whatsoever after a daily conversation, she will contact me immediately. And that has not been at all, maybe at the very beginning, and that was just concerning some PPE, but as she has indicated, Tom Berger does deliver the PPE request to that facility. And we did talk to Tom yesterday, Tom Berger, and he had said that all of their PPE needs have been met.
So Patrice, who's responsible for investigating and being there and overseeing their medical care and their nursing care? Are we the group that's responsible for making sure that the nursing homes, the long-term care centers, are following the Iowa Administrative Code and the Iowa Nursing Plan? Are we the party responsible for that?
Actually, Ann, it's my understanding that they are a licensed facility, so they would fall under the umbrella of the Department of Inspection and Appeal process, that if any family, had any concerns after talking with any long-term care facility that is licensed, that they have the ability to contact the Department of Inspection and Appeals with a licensure. But again, with our protocol, Stacy making daily contact and the state is also making daily contact, we are helping in any way that they're asking for our help. And I know that Stacy has provided guidance to them, if not on a daily basis, every other day, quite often. So actually, it's their licensure component that if anyone, really feels as though they are not following, and that's not just for this facility, it's for any licensed facility.
Patrice, this is Diane Pate-Freiberger. I have a question, and I think we're talking about oversight here, our local oversight of what's actually happening. I think that those of us who have been through the webinars and through the criteria for long-term care facilities understands, of what the mitigation strategies are supposed to be. I guess at this point, I think that the family's asking who is overseeing to make sure that they're following through. You're saying that they're licensed and that it's that through their license that they're supposed to be doing these things, but we do not know without an actual direct oversight. And so is that the state level or the county level to do that? The other thing is with the mitigation strategies, are these recommended or mandatory by the state? the PPEs, the wearing of masks, those kind of things. We know that it's in some facilities in Dubuque, the employees are mandated by the employers to do these things. But are all long-term care facilities, are they supposed to be following the mitigation strategies, such as the correct use of PPE? Thank you.
Oh, Diane, without me speaking out of inappropriately, because I do not know all of the answers, Stacy and I will be glad to contact the state and get what your questions were, get those answers.
Well, that's what I understood the family to be asking.
Sure. And it's my understanding that actually for all facilities, it would be the administrator who would be the number one person to follow through. But as far as mandated or recommended, I can't tell you with all of the protocols what the state is mandating and what the state is recommending. So that's what I need to get clarification on.
It seems like we need to put together some kind of answer for families. Mr. Freeze and Ms. Burmeier are here today, but there's many families in our community having these same questions about they can't visit their loved ones, and how frightening must that be? I don't have that lived experience. But who's there to ensure that this is happening? And if my understanding is, unfortunately, it's at the state level. So what are those phone numbers? What's the phone number for the patient advocate, the ombudsperson? Let's get some things together to give the families who they can call and send this up. But, our Board of Health are volunteers, and they, good or bad, are not in the specialty care, making sure that they're following their nursing protocols. It would be impossible and inappropriate. But, there are layers to nursing home and to long-term care that the state has put in, but I don't know that those folks have been contacted. I'm happy you're here and sharing your story. It's bringing motivation for us to respond to a different group of individuals that we don't hear from. So, we can certainly do that. And, I would expect that Representative Eisenhart and State Senator Pam Yocum probably would want to be in on this too, building that list of resources at the state level for folks to call. And, Mr. Freeze and Ms. Burmeier, maybe you can indicate, maybe you haven't contacted the folks further up in Des Moines, and I don't know if they've been responsive to your concerns.
And Ann, I would also like to mention to family members that if they go to the Iowa Department of Public Health website, if they just go to that department one, not onto the new coronavirus, on the left-hand side, there's always a listing of guidance for various agencies, and there is a section for long-term care. So if they click on that, they can get a lot of information of what the long-term care facilities are following. And I'm just looking with the PPE, it states that it is recommendations. So those are the items that Stacy and I will need to follow through, because I don't know what is mandated and what is required. But we'll be glad to find that information, and we will work through all of the administrators with the long-term care in the county. And once we find out what is the guidance, who should they report to, if the residents' family members do have a concern, what is the command of action? Stacy, and I hate to speak for you, Stacy, but I know you'll be willing, but we'll be glad to check all of this out, and we'll get that information out to the administrators of those long-term care.
We will also, just to tag on with the trace, we'll also come up with a list of contacts to give out to families.
Stacy Dave Baker, we cannot hear you.
I'm so sorry. I'm like 1 inch from my microphone. I think I have some audio issues. Is that any better?
That's much better. Thank you.
Okay. I'll just sit right here. Just to tag on with what Patrice had said, we will also come up with a list of how to, where to, and what families can do to get the answers. And like Anna had mentioned, those additional layers, we will come up with something in writing. We will share it with some of our our state and local representatives, Board of Supervisors, Board of Health. So then that way, if families do contact all of you, we will have something in writing.
If I just might add, I don't know if you can still hear me.
We can hear you, Steve.
Yes, we can.
Thank you. You know, the reality for us is the Department of Inspection and Appeal, this is not something that we have the ability to see inside the nursing home other than on Skype that they're not wearing their PPE. And if it's just a guideline, you know, that might be something that the Board of Health and the county board may need to consider, that it becomes mandatory. Because there clearly has to be something going wrong if you have 40 of the residents, and whether it's 60 or 65 that are there, it's more than 60% of them have tested positive within less than a month. And it clearly looks like it's going in the wrong direction. It's not going in the right direction. And before long, you may have the entire facility that is going to be infected. And granted, this is relatively new for your volunteer board and the Board of Supervisors to deal with in your county, but for the nursing home, this is not their first problem. The Lynn County facility they have has even a more significant problem. And you would think that things would have been put in place to learn from that first unfolding of this infectious disease. And you know, ultimately, you are the leaders on public health for your community, and hopefully that you can help put some safeguards in place that they have to start following. Otherwise, when the next round of this happens, if mom survives this, she's going to be susceptible for it again. And so will all of these people in these facilities. And I greatly appreciate your willingness to listen to my sister and I as we share this with you, because you don't have family members in there, and we do, and we see this firsthand.
You know, Mr. Freeze, I know from my personal past legal experience, the legal aid, so Iowa legal aid, there are that, and I see Mary shaking her head no, but there are legal resources provided by the governor in some of her past proclamations where you could inquire of an attorney. Certainly, I've been in nursing homes over my years as an Iowa legal aid lawyer, being that legal feet on the ground for family members that haven't been able to be present. So that's something you might explore. Of course, there's guidelines and there's eligibility, but you know, the state has put in some additional funding for the Iowa legal aid to kind of beef up that as well. We're all working on this as best we can, and it's a horrible situation.
I appreciate that, and that was not even the angle I'm going at. You know, if on April 22nd, they could have told us through their contact tracing that mom was or was not exposed to the staff member or the other resident, that would have allowed us to make a timely decision on whether we kept mom in the facility or not. And, you know, to this date, almost a month later, they have not shared with us as a corporate decision, I assume, because there is no way, quite honestly, Supervisor, that I have the ability to figure out the name of anyone else in that nursing home. We don't know anybody else. And so it's not like there would have been a HIPAA violation from that standpoint. They should share with us if they were exposed. If mom had not been exposed, we could have made the decision or had the opportunity to make the decision to bring her home. She was, you know, there after recovering from a broken hip.
And Mrs. Patrice, I just wanted to add, somewhere in the conversation there was a question, or Ann, you might have brought that up with the ombudsman. There is actually an office of the state long-term care ombudsman. It's iowaaging.gov. So I'm just throwing that out. I didn't mean to interrupt. I hope you were finished, Mr. Freeze. I didn't mean to interrupt your conversation.
Yeah.
You did not interrupt.
Yeah. Ed Raber has listed that in the chat for us. So in the chat, if you click on the chat button, you'll see that, well, Ed sent that to me. Ed, why don't you make that private to everybody? So we all have that information. You can jot down the website, and I'm sure their phone would be easy to find as well.
And
Chair Betchen,
Ann, I appreciate
I'd like to make
that.
a comment if I could.
Go ahead, Jay.
Thank you. First of all, thank you, Mr. Freeze and Mrs. Bermeyer for coming here and sharing your story about your mother and the care facility. I have great empathy my uncle, Bill McCallum, passed away in a facility in Georgia from COVID-19. And so I understand the pain and suffering that you're going through as a family and the nervousness. But what I'd like to do is talk a little bit about the words that you were using, Mr. Freeze, related to costs and budgets. And this would also be a comment to the Board of Health, Board of Supervisors, and other people. I think when we start talking about costs and budgets, I think that we're doing a strong injustice of the use of the public funds that are entrusted with us. This should not be a cost issue at the levels we're discussing. The Board of Supervisors has appropriated $500,000 to the Board of Health. We've also appropriated $200,000 to the Emergency Management Authority. That's $700,000 at your disposal, all of ours, to help solve and provide services and preparation and mitigation for COVID-19. Back behind that, we have over $10 million in fund balance that is there. And I couldn't think of a better and higher use, a higher priority, than to use our funds that came from the public to help solve the needs of the community. And so the language we use related to budgets and somebody else paying for it and the cost, I really believe we're doing an injustice to the public related to those public funds that are entrusted to us. We have the ability, we have the funds. We've been very fortunate in my tenure in the last 5 years of having strong financial balance, and we made great decisions related to those funds. We have the financial ability to do more for this community, and I encourage all of us to think in that manner.
Jay, this is Diane Pate Freiberger, and for the family, I'm on the Board of Health. I empathize with what you're going through. You know, that it's things, just like Dave said, that keep us up at night thinking of this happening. And I do not have a family member inside one of those institutions. So I cannot directly feel what you're feeling, but I can understand what you're feeling. So I think at this time, thank you for the information you have given. I think that we've posed some questions regarding direct oversight and the availability for individuals to get answers. And we have directed those back to Patrice and Stacy, and they have said that they will follow up and let us know. And I do not know what's going to be in that communication and whether we could directly communicate that back to you or not. But I understand where you're looking at. You know, it's not what is corporate doing or what is the administration doing, but it's an oversight of those, because we're seeing that with other mitigation strategies throughout the whole country, but in Dubuque County also, it's recommended to wear masks. So we go back to enforcement and oversight. So, but I do appreciate your comments and for coming to us. Thank you.
You're welcome.
This is Dave Baker. I want to just, if we're having communication issues with this facility or any other of our long-term care facilities, and management is not cooperating, then there are other things that can be done. This is a public meeting. So employees of these facilities, family members who have loved ones, if you have an issue, get a hold of Dave Baker, Ann McDonough, Jay Wickham, or Board of Health members, Chair Tom Beschen. Let us know so we can help advocate for you. And why would management or administration be uncooperative? My guess is for legal positioning, which I think is a bunch of bull crap. We're talking about trying to save lives. So if they're not cooperative, then there's other things that can be done. Use my former organizing skills. I'm putting word out. Get a hold of us. Mr. Freeze, I have your sister's information. Be happy after the meeting to exchange information with you. We need, and I'm not picking on this one institution, because it sounds like there's more than one, that isn't given the highest level of cooperation. So this is hopefully putting them on notice.
This is Diane Hike, and I'd like to make a comment, but I'd like to hear what Mary has to say first.
Okay, can everybody hear me? Okay,
Yes,
I'm not a public speaker. Okay, but earlier on, somebody from the Department of Health, whomever, asked the question, what didn't they do? Okay, it really matters not the fault. The fact is that there are 67% of this long-term care facility residents who have tested positive. Everybody has failed. My questions are, why wasn't the health department at Dubuque Specialty Care overseeing their infectious control processes when there was an identified outbreak at another facility owned by the same organization? You've seen it coming. Anybody could see it coming. They knew that there was an issue. You should have known that there was an issue because in early February, they had an outbreak of stomach flu that went rapidly through this organization at Dubuque Specialty Care. It wasn't news. Everybody knew it. Who was responsible for it, think about it. You are the first line, as my brother has said. You are the first line. When the health department found out that there was a resident who tested positive, why wasn't the VNA there? VNA, as far as I am aware, and I talk to the facility every day. I talk to Brooke. I talk to my mom's nurse. I talk to anybody who I can there. VNA still isn't there. In order for mom to be out of isolation, they get a call from VNA, and they go over it with VNA. Nobody is there. They all knew that there was an outbreak the minute that there was a resident who tested positive. These poor souls have been entombed there since March 11th. The only way that it could have gotten into that resident was through a staff member or somebody who came from the outside. There's no reason, as Dave has said in the articles in the TH and what he said here, there is no reason that the testing wasn't done. That was what the problem was all along. Nobody seemed to have any urgency until it came to the health department and the supervisors when they met on the 29th. I don't think you guys were informed on what was going on. You guys acted quickly. Representative Eisenhart was amazing. Dave Baker, amazing. The Board of Health, amazing. But the Department of Health for the city and the county failed. When there was a confirmed outbreak at the care facility, why didn't you guys do anything? Why wasn't somebody shouting at the top of their lungs? I said this to Brooke. Why aren't you yelling it? What do you need? Tell me what you need. I will go. I will be your advocate. Nobody was doing anything. It was like it wasn't a big deal. Okay? Even the Department of Health, when the Board of Health said, get everybody tested today, by the end of the day, the Department of Health pushed back. Okay, we're not on the same page. As far as I'm concerned, the owners of the Dubuque Specialty Care, the management, the City of Dubuque's Public Health, the Visiting Nurses Association, Iowa Department of Public Health, all are culpable and complacent in what happens to the residents at this facility. There was nothing done. My mom fights for her life now because nobody took action on the 22nd of April when there was a confirmed case or before, which I believe should have been the case. Now I've heard that there is a staff member at Luther Manor who tested positive for COVID-19. I hope their experience is different. I hope somehow we've learned, I expect not, and that whole facility is not infected like mom's is. Thank you for your time.
Thank you, Mary. This is Diane Heiken, and that's why I wanted to wait to hear what you had to say, because I agree. I think it wasn't a question in this case about finances. I think we were willing, as soon as we found out, to move ahead and test people, but it's a timeliness issue. That's what I hear your brother saying, and it's what I hear you saying. And back on the 22nd, when there was a positive, maybe different action should have been taken. And we do need to learn from this. And I would suggest that the guidance that is put out, this is new territory for everybody, but I think that it didn't work. And when something doesn't work, you need to modify it. And we certainly need to modify any guidance, as the terminology has been thrown out, from IDPH, for a facility that has this many cases in residents and staff. So probably the guidance that's coming from IDPH is not really helpful or useful at this point, because this is a whole different scenario. It's a whole new ballgame. So Patrice and Stacy, can you specify that this facility and any facility in our county is getting modified guidance from IDPH on how to move forward when they have this many cases? And when we get one case, I guess Tom will have to have this on the agenda, but can we begin moving forward more aggressively and testing? I do want to clarify with the family that it sounds as if when we directed the testing on the 29th, did your mother, and if you don't want to share it, you don't have to, but I heard you say she was negative maybe the first time, but it took a second kind of push to get tested again, and that's when she was positive?
She was negative on the first test that you all instructed to be done. And it took 3 days from the point, I believe it was 3 days from the point when the test was administered to the results came in. And then when the results came in, she was already showing what we believe were symptoms: pink eye, extreme fatigue, loss of appetite, diarrhea, and coughing. So everything but the temperature. And it wasn't until my sister had the normal telemedicine checkup with mom and her medical doctor that we had another order by her medical doctor, not the doctor at the facility, but her personal medical doctor ordered another test result, and that's the test result that came back as positive. And now for the challenge for us is, she's going through what we hope is a recovery process. It appears that the facility isn't going to administer another test to see if she is now negative and clear of the COVID-19. She's going to be staying in the isolation ward for a period of days that I'm not sure if there is guidance on how many days that really should be based on how long it's taking people to recover before she can be moved back into the non-isolation area, which the way it's going, the whole facility is probably going to be an isolation area. But that's how it laid out for us.
Okay, well, thank you for clarifying. I'm sorry she's experiencing all of this pain, and I'm sorry for your family. But I think we need to look at this, and we need to make sure this doesn't happen somewhere else, and that we slow it down as much as possible in that facility. So we can use IDPH guidelines and guidance and protocols as a basis, but I think that if we're allowed, Tom, if you need to check with CJ, we need to come up with stricter guidance that, we want to protect our own county members, our residents. And if there's nothing against that, I think we need to have that on the next agenda, and we would need input from Stacy and Patrice and our long-term care liaison. I don't know where that person fits in on this, but there's nothing that shows that what we did there, what mitigation efforts we used worked, obviously. So we can't just sit still and wait for this to happen in another facility or for more people there to be infected. Does that make sense?
That totally makes sense, Diane. And this is Diane Pate Freiberger. I would also like the answer from Patrice, which she is going to request from IDPH, whether we can make this mandatory, the PPE usage. And it's not just for one facility. We're looking at all of our facilities right now.
Yep.
Right. I'm thinking that's why we need to have CJ look at what we can do as a county. What kind of rules and regulations can we put in place for our county? And not just the PPE, all kinds of protocols. And I'll tell you one thing I'm noticing out in the community, and It's really starting to bother me, and this is another issue for our long-term care liaison. I work in retail down at the Walgreens on East 20th, and I am seeing numerous now, people coming in their scrubs. They are healthcare workers that are wearing those scrubs out in the community, heading in on a shift. They're wearing them after. This is common sense in my mind, so that's another thing I'd like addressed in our community, and that should be something that should be addressed through all facilities and healthcare offices. Some are long-term care workers, some are, in private practices, but that to me makes zero sense. To wear your work uniform into a retail setting on your way into a shift.
Okay.
And just to be out in that setting on your way into a shift, or to come off of a shift and be out in the community. Things like that we need to start looking at.
Diane, this is Tom Beschen. I agree with you that we need to assess making it mandatory, but I also think that we need some guidance from CJ before we can address that. And I'd ask him to possibly take a look at this and see if we can do that. If we can, I think it goes to the Board of Health and we make a recommendation. But right now, we went through this with the whole shutdown question about a month ago, and I don't want to put a recommendation out there that's not going to be followed. If we put a mandate out there and people don't have to follow it, what have we gained?
Exactly, and that's why I know we need to consult CJ before we could move forward. I'm thinking something along the lines of how we have the ability to do the isolation orders. And I think, with my limited knowledge, I think anything we propose then has to go to the supervisors as well. So it wouldn't be a quick thing, but we have to start somewhere by exploring it.
Okay. I've also had a message from Chuck Eisenhart that he has some information he'd like to share. So let me find him and unmute him.
Thank you, Tom. Appreciate the opportunity to give you a bit of information that might be helpful, set a framework for your future discussions. Appreciate former Representative Freeze and Mary from coming on today to help identify issues. If you look back in your email late in March, I forwarded to all the local elected officials a briefing that we got from our Legislative Services Agency that summarized the extraordinary powers that various levels of government have in a declared public health disaster emergency situation. The governor, the Iowa Department of Public Health, and other levels of government. And as I understand Representative Freeze's question, I think it's about the difference between enforcement versus voluntary compliance and the different results that may come out of those two approaches in light of a lethal pandemic. You'll find in that brief that the Iowa Department of Public Health has extraordinary power to come, and in the statute itself, it says can do, if necessary, through an administrative warrant, an assessment of any facility to determine whether or not changes are needed and to order changes if necessary. Now, I'm not aware of what the administrative rules are surrounding how they implement that. I'm not aware that they've done that in this state in any of those 36 facilities or so that have had outbreaks. But perhaps their process is they wouldn't even consider it unless approached by the county board of health. In any case, that's one example of a power they do have, and you might want to have that conversation about whether it's that department or the governor, when, under what circumstances you would work with them to bring heightened attention to any specific situation where you need it. And the second thing I'd just like to mention, since it was brought up, I'm aware that there may be more than one other facility in the community where one employee has been identified as having tested positive. And while the state has said it will make resources available for all employees and residents to be tested, that's on a request basis now. And I understand that in my conversation with one facility administrator, they're still considering whether or not to make that request. I think there should perhaps be a discussion among the Board of Health of whether or not, if you can, to require that testing be at least made available on a voluntary basis to all residents, should they choose to take advantage of it, as a preventive measure rather than just a response measure. And I would be happy to, help communicate with the state to, make sure those resources become available in a timely manner if that's the direction you choose to go. Thank you.
Thank you, Chuck. Okay. Thank you, Steve and Mary.
You're welcome, and thank you for the opportunity. I'll let you get on with the rest of your meeting then.
All right. Okay, moving on to the isolation shelter plan. I haven't been able to check email in the last hour and 20 minutes, so I'm not sure what has transpired since then, but we did have a meeting yesterday, Patrice, myself, Ed Raber, and Ann McDonough. Ed, would you like to update us on the status of that discussion?
Thank you, Tom. This is Ed Raber. In our discussion, we are looking at opportunities for how we would be able to potentially respond to the language that the city of Dubuque had in a request for proposals. That was actually due yesterday, but we've let the city know that we were not going to be able to respond at that time frame. We're looking at a variety of ways that we might be able to accomplish that, and I think the discussion I had earlier today was that we are planning on meeting again to continue our work to see how we can partner with our partners at the city in some fashion to help stabilize and solidify the situation for a sustainable future.
Okay. Yeah.
And so something there is no other report besides that. We hope in the very near future to have something for the board to consider.
Yeah, and to be a little more specific for those who weren't involved in the meeting, our hope is to work out a way to partner with what's already been done by the city staff to make it one shelter for all of Dubuque County or one shelter effort that services all of Dubuque County residents. And that's going to involve some action on the part of the county as far as taking a more active role in that. So discussions continue. Anything else on that? All right, Board of Health COVID-19 message. The reason that's on the agenda is this is something that was brought up at Monday's meeting. And what is the Board of Health's message to the general public now that things are more open? And I was kind of hoping to have had that after Dawn's update on the survey of the department heads, because I don't think we can have one without the other. Comment?
I would say, Tom, in as much as I'm going to be a part of that, the meeting cycle is pretty tight, and so I have not been a part of any broader conversations yesterday related to that agenda item brought up on Monday, but I plan to. I would like to be a part of those discussions as we move into the remainder of the week.
Okay. Yeah, I think that's.
It's just a very tight turnaround between Monday and Wednesday morning. So
yeah, I agree with that, and I would like to carry this item forward.
Thank you, Tom.
And Chair Beschen, this is Supervisor Wickham. Just a point. So this was discussed and brought up at the Travel Dubuque meeting with their board, and present was Mayor Buell and City Manager Van Milligan, along with City Council Member Jones and other board members. And so it was generally discussed that possibly a change in a message is needed, and we should partner with the city to make sure that that message is unified.
Okay. Supervisor Wickham, do you have a name I could contact to get that partnership rolling?
Yes, I think we could coordinate through the Board of Health, through the city, and possible Travel Dubuque if you wanted their involvement as well on what is that message. And as you can anticipate, it came up at the Travel Dubuque meeting because they're like, what should our message be? We're open for business, come see us, come and have fun, or stay at home. And so those are obviously two opposite messages. And so they're very interested in what the messaging should be now that the state legally is open, and many businesses are legally open in both travel and entertainment. And possibly, Ed, is this something that you could help coordinate with?
Yes, I would be happy to do that. And Tom Beschen, I do have that connection with Travel Dubuque as well as with the city. So
very good.
Chair
Okay,
Beschen,
thank you.
If I may, this is Dawn Sherman. So what we did with our survey was looking just at strictly county operations. So I would ask that this discussion about your message continue, because whatever our actions are for internal county operations, we absolutely want to be consistent and lead by example, consistent with the Board of Health's message. So we're planning, whatever our reopening will be, if it's phased, but we want to ensure that if we look at something about the public being required to wear masks, that's consistent with the message of the Board of Health. So we're looking towards you for some guidance on that as well.
Okay. All right. I appreciate that, Don. Okay. That will, we'll see if we can get something done between now and our next meeting. Hopefully we'll have time to do that today, tomorrow, or Friday. Thank you. Items 4 and 5 on our agenda: declaration of disaster emergency communication and congregate shelter level, in my mind, are the same thing. Basically, what we're looking at here is, okay, thank you. We're looking at a letter going to Des Moines. What do I want to say? Recognizing proclaiming the disaster emergency and our position that we want to, through FEMA, help fund the non-congregate isolation. Ed has...
Yeah, Chair Beschen, I'll provide brief comments if I can. In the packet was a draft letter. It's just a transmission letter. As Tom and I have discussed in putting it on here, it's not really an action item, just letting you know. The declaration that the Board of Health approved last Wednesday, I think it actually has found its way where it needs to go, but in an official capacity, this is just a simple transmission letter stating what happened that goes to the state. That at some point will be bundled with some other information from anyone with a shelter, a non-congregate shelter seeking reimbursement. And right now, that's the city of Dubuque. Information that they'll be providing when they seek reimbursement will be bundled with this letter, the declaration, and forwarded to FEMA in Kansas City. So this is just somewhat of a technicality, but just to help people understand where is that declaration going, we thought this would be a helpful thing to let you know how that is moving along and where does that go and where does that matter. So strictly just an informational item that Tom and I have discussed prior to this. So that's what's going to happen with that.
Okay. Yeah.
Somehow there's some magic and somebody gets a live signature from Tom on this.
Okay, well, yeah, and this was intended to be just for your information. This is how this is working. I don't see this as anything that requires any action other than a signature and a stamp.
Thank you, Tom.
Okay, are there any other questions for the Board of Health? That is the end of our agenda. Hearing nothing and seeing no little blue hands, I'll turn it back to you, Chair Baker.
Okay, thank you, Chair Beschen. Is Tom Berger on yet? Okay. I was looking for Tom Berger. Apparently he's not on yet, so we will go to the next item on the agenda under the Board of Supervisors agenda, item C, approve letter of support, Medicare coverage for Marshallese community.
Chairperson Baker, I make some opening remarks on this. This is Ed Raber. The letter that I drafted is just for your consideration, and this would be an action item. Had been brought up in some discussion previously, in fact, a couple of weeks ago, but earlier this week, the city of Dubuque took some action communicating with our congressional delegation. This particular letter just is addressed to our Senator Charles Grassley, but the intention would be to do that to Senator Ernst as well as to Representative Finkenauer. Just encouraging them to consider some current legislation that would, in the eyes of many, correct an oversight from 1996 that pulled away or withdrew access to Medicare for citizens of freely associated states through the Compact of Free Association. So the Marshallese, that's a good example here, and some other populations from that part of the Pan-Pacific. They're in our community. They have limited access to things like Medicare because of that legislation in 1996 and welfare reform. They just seem to happen. There are certainly a lot more Marshallese in the United States living here, which is a thing that they are able to do without a visa. But they're just not eligible for that. And this would be a letter encouraging our legislators, who I believe actually are in support, we're not twisting too many arms, to let them know the importance of that at the local level. So City of Dubuque adopted a somewhat lengthier version of this at their meeting on Monday night, and the board has discussed that. I had talked about it a little bit with Chairperson Baker. So it's strictly up to you if you would like to do that, just in a timely fashion, following on the heels of our colleagues at the city. I bring this up for your consideration.
I'll comment on this. This is Dave Baker. When the Marshallese first came here, they were covered under our social insurance programs, and then as part of restructuring or welfare reform in the mid-90s that was taken away from them. And I personally know some of the marshalees. I represented them in their employment, and so right now they have only employment-based health insurance or what they're able to buy privately. And with the unemployment rate in Dubuque County approaching 20%, my guess is that there's a good number of them that don't have insurance, and we know that they've been impacted. I think a letter such as this, I would support asking our United States senators and representatives to consider reinstating the Medicare or Medicaid benefits for these folks. I would support this letter.
If that were to be a motion, I would ask that this letter be sent appropriately addressed, of course, to our senators and representatives. This illustration is just to Senator Grassley.
Chair Baker, I know that Art Roach is on the phone right now, or on the Zoom meeting, if you would like to address anything before we move forward with the approval.
Okay, can we unmute Mr. Roach? Art, can you hear us?
I think I'm unmuted. Yes, thank you. Thank you. You know, I have very little to add. I think the letter's excellent. I think, and it should go to all three of the legislators mentioned. And yeah, this is a long-term solution to the problem, but one that has been in the works for a long time, and the support of the local entities as well as the state legislators is really critical. So I think the case was well made for it, and thanks to Ed and others that have spoken up in favor of this. So I won't belabor it further. Thank you if you choose to proceed with this.
Art, thank you for being with us on Monday, and you really brought, I think, the need for this before us for the first time. Certainly we have understanding of the community and their concern, their inability to have insurance. I understand that well, but that you were here asking us to do this, and then of course Monday night the city of Dubuque taking some very strong action. So by you being with us Monday, in addition to RRS Stewart and Megan Ruiz, who was here, I think, from Presentation Lantern, so we had 3 representatives from immigrant communities who are advocates for those parties. I appreciate that, and I think this is a natural step and a good step for us to take. Certainly something that's within our ability to send a letter on to our congressional delegation asking for them to cure something and make something positive happen for our local healthcare providers as well.
Thank you. The lack of this Medicaid availability is really showing up to a great degree because of the coronavirus pandemic has made this population that was already extremely viable or vulnerable. That's the word I'm looking for. Right. It just hit them much harder than other parts of the population. So thank you.
Is there?
I'll make a motion to approve the letter, direct the chair to sign it on behalf of the Board of Supervisors, and to forward it to both federal, state, and local officials as they seem necessary to gain support.
Second.
Motion made and seconded. Any further discussion?
Thank you to Ed.
I'm sorry, go ahead, Ann.
Thank you to Ed. This was actually, of course, Art, but also to Ed Raber. I think that this is in recognition of his ability to pick this up and move it forward for us. So I think this is, thank you to you as well, Ed, for getting this done administratively.
Agreed. All right, any other discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0.
May I say something more, please?
Go ahead, Art.
Okay. Well, I didn't want to muddy the waters. I'm happy that this letter and support for restoration of Medicaid was passed by the Board of Supervisors. Thank you. But a second related matter is the more immediate concerns with the Marshallese community and the other immigrant communities in Dubuque, and the need, I think, for the same kind of urgent letter from the Board of Supervisors to the governor asking for more immediate relief for this population. So in some other states, Medicaid has been totally restored. Just a few other states, Medicaid has been totally restored for COFA migrants like the Marshallese. That's a rare solution. We'd love to see that happen, but failing that, we'd like to petition the governor for some more immediate financial medical assistance for COFA migrants. And I wonder if we can go to work on that sort of a letter as well. That's maybe.
And who else are you working with on that?
On the letter?
Well, in the approach to the governor. So you're before the Board of Supervisors. I'm asking who else, what other boards, what other government entities, who else are you working on to address the letter to the governor?
We will be asking Creston Community Health Center, which is the principal provider of healthcare services, and the two hospitals, Mercy One and Finley, to join us in that effort. Beyond and the Pacific Islander Health Project Planning Council that I chair will also be part of that.
What about our delegations to the State House and to, we have other partners there that I think could take this up. They're going to be going back certainly in June.
Yes.
How do we make that be a priority for legislative action?
I think we just need to corral those legislators and ask them to support it.
And would you be doing that then?
Yeah. Yes. I think the Dubuque Pacific Islander Health Project Planning Council is the organization that's moving this forward, and I chair that.
Art, I would suggest that we go through the similar process. So I would ask that you involve Mr. Raber in the discussions, and it wouldn't be a proper subject, obviously, for today because it was not on the agenda, but
right.
We can schedule a work session, and I'd ask you to work through Ed Raber on this matter.
Okay, thank you.
There is a bigger issue here too. This certainly addresses the immigrant community, but we have, as a society, tied our health insurance to employment. And with reaching 20% unemployment, does this board want to look at and join with perhaps our state legislatures, the team, to be looking at any policy we might want to make about Medicaid provisions for folks who are without insurance? So, is there something broader that we should be looking at and might come under the umbrella of economic development? Is there a broader stroke that we want to take with regard to health insurance? The hospitals here are not losing funding just because they're serving minority populations. There are many individuals, some who are worried about going to seek health care because they no longer have insurance under our current system.
And I agree that there are, other big picture issues. There with the Affordable Care Act, which certainly wasn't perfect, but there were steps taken to include younger folks up to age 26 on their parents' insurance plans, and there was, I think the initial ask was to drop the age for Medicare down from 65, and that did not happen. But those are steps that hopefully will be looked at. But I think those are not things that are going to happen short term. I think that's discussion that needs to take place, and it sounds like Art has some specific issues in mind for immediate financial and medical help, and requesting that from the governor. So, but I agree
well,
with
ultimately,
you.
It's ultimately all advocacy. None of this is going to happen, at least not what you're talking about now, making Iowa a Medicaid eligible state for individuals who are here in a different type of citizenship status or immigration status. We can advocate for that, but it is part of a bigger picture in terms of those who are uninsured in our community. It's far broader than just folks who are immigrants. There's a deep need in our community for health insurance access for many individuals. So that's what I'm saying. It's if we're going to take an advocacy position, I don't want to not be willing to recognize and address a broad range of this of folks who are now without insurance.
Okay, thank you. All right, we're going to move forward on the agenda. We have next item is item D, which is the reopening update. And I have communicated during this meeting with Judge Schubot. So I'm going to ask if we can unmute Judge Schubot and let him give us an update from the judicial branch.
He's unmuted.
Hello, can you hear me?
Go ahead, Judge Schubot.
Oh, okay, you can hear me?
Yes, we can.
Right.
Yes, we can.
Very, very good. Well, thanks for the opportunity. I just wanted to let the board know as we get closer to the June 1 reopening date, which is the date the judicial branch is also scheduled to resume operations. I just wanted to give an update on all the steps that we've been talking about. I've been in a number of meetings since the board last met as we try to decide how we're going to conduct our operations safely. And I know the board is very concerned about, everything that happens within the courthouse, whether it's a judicial operation or a county operation. So I just want to make sure that everybody is informed. I did not specifically respond to the mask survey that Dawn had sent out. I don't have any direction from the statewide committee that the judicial branch has formed that's looking at the issue. But I want the board to know that, we are going to abide by whatever the board decides is appropriate for the courthouse, at least in terms of the common spaces. What happens in our offices and at times during the court sessions in the actual courtrooms may be required for people to be without masks, but otherwise we're going to go with whatever the board decides. We'll do that decision. As you know, June 1, I think, is the date that we've been looking at. That is what we have been calling a soft opening with a capital S. We are not bringing back all of our staff. The clerk's office will continue to, a lot of them will be operating from home. So we will, that office probably will not be fully staffed on site for several months. And that's true also of some judicial officers, some of our administrative staff. Basically, all of the hearings that we've been doing, we've developed a process for doing a lot of our hearings remotely, and we are going to continue to do anything we can do remotely by telephone or by video. We are going to continue to do things in that fashion. We're not going to do them in the courthouse just because we have the ability to do them in the courthouse, because we share in the board's concern for public safety, and we do not want to bring people into the courthouse unless there is a reason that they have to be in the courthouse. I think this is going to work well in cases where people have representation. It's a bit more challenging in cases where people do not have representation. So that I'm thinking about misdemeanor court, traffic tickets, those kinds of things. Coincidentally, those happen to be some of our higher volume court sessions. So that is a big challenge. We had a separate meeting just yesterday trying to decide how we are going to handle cases in which there's no attorney to reach out to. CJ's staff participated in that meeting, as did Maureen Kwan, who is the city attorney that handles most of those cases. And we're really taking a team effort to that approach. They're going above and beyond to try to reach out to people who have upcoming pretrial conferences. You have to understand that on a Wednesday morning, in the ordinary course of things, I mean, that if we don't do anything, there could be up to 50 to 100 people showing up for those, and obviously the North Courtroom can't accommodate that, nor can security at the front door get those people through. So we're trying to resolve all of those cases, and then also prospectively moving forward, trying to come up with a plan, and we have a tentative plan to try to reduce the amount of people that will show up in the first place. That would be for people getting tickets and everything from this date moving forward. All of that said, there are going to be proceedings that have to be held in the courthouse. Right now, the date for resuming jury trials is July 13. That date could move, but right now that's what it is. That's our biggest fear right now, is how we're going to be able to handle that. Ordinarily, when we pull in a jury pool, we'll pull in between 30 and 40 people. The North Courtroom can't accommodate that. That means that we would probably be using up to 2 to 3 courtrooms for a jury trial during the jury selection process. We'd also probably be using a courtroom for the jury, because we are not going to be able to socially distance people in our jury rooms safely. So those are some concerns that we have. All the courtrooms are relatively small. I don't know that anybody's done formal measurements yet, but Monday, after I finished my work at the courthouse, I was just walking around the North Courtroom in the dark, trying to visualize how many people could get in there safely, socially distanced. And I had a hard time envisioning that more than 20 people could ever be in that room, keeping a 6-foot distance. I think our other courtrooms, maybe half of that. So what we're probably going to be doing, as I said, is trying to split proceedings between different courtrooms when we have proceedings that are going to require, more than those numbers there. And we can do that. The problem is going to be that it is going to make space a much bigger problem than it was before all of this with the shutdown and the quarantine came up. And that is just a segue. I guess I want to ask the Board of Supervisors, and I'm not asking for
any kind of answer or even prolonged discussion today. But I mean, the issue is, I just want to put it on the radar, but I want to respect the agenda as it's written. We need to have some direction as to what is going to happen with the plans for the first floor courtroom that we talked about, had been talking about for some time, and had finalized the plan earlier this year. At this point, before, I mean, it was a kind of an operational headache for us in terms of, where do we conduct proceedings? How do we, not bump trials? How do people, get their issues heard? Now with the virus and our operations and some of the things that I've just talked about, it's really become a safety issue. And it really gets down to, how do we conduct our judicial operations while at the same time getting people to properly socially distance, and that requires space, and so we need that space more than ever. And I know that the board is faced with all kinds of fiscal challenges that are complicated by constraints that didn't exist a few months ago. But as Mr. Wickham pointed out, I mean, sometimes you have to try to look beyond the budget when issues of safety are concerned. I'm hoping that, that I just want the board to understand that we really do need to have that space as soon as practical. We do have furniture ordered. It is being delivered. I'm not sure where it's being stored, but I want to get that issue to the board's attention so that it can be maybe placed on an agenda for a future meeting, or you can have time to digest that and think about that. But, from a judicial standpoint and our operations and being able to keep people socially distanced, we need to have some direction as to what's going to happen and what kind of space that we're operating with as soon as the board can get to that issue. So again, I don't need an answer today, and I don't expect you to have an answer today. It's not an agenda item, and I appreciate you allowing me to be heard on it. Does anybody have any questions for me?
I do not, but I see Ann's trying to make a comment.
Judge Schubert, I have a couple items. I think putting an agenda item on and getting an update from our facilities manager and our HR director, who was charged with overseeing that, on that courtroom is overdue, and I think that's an easy thing. We still have agenda for Monday that we could have, I'm sure, a work session to bring us up to date on that. I would be generous and offer you the unlimited use of the Board of Supervisors space. We don't meet there. So you should, of course, walk that around as well to see how that can be transformed for your usage. We are working remotely and by Zoom, so that space could be available to you as well, I think. I think we should look for jury pools of 30 to 40 plus people, maybe looking at an offsite location to do voir dire, to look at that in a way that maybe it's a Five Flags theater or a space inside some kind of civic place where we could, spread out and assign people to their seating before the interview takes place. That wouldn't have to be, I don't think it's required that it be at the courthouse. We'd have to address some security concerns and things as well. But I think all of these are breakout moments for us to look differently at, what can we do to change our facilities and look outside of maybe even our traditional spaces to accommodate the needs you're describing. I'll say that in my conversations with county employees, the biggest resounding fear that they have at the courthouse is, when will the judicial branch come back up to speed? They recognize that you create significant traffic, and even the law enforcement at the front door is saying this is a big thing we're going to have to work together on. I'm not sure that, you know, I can give you an answer of what we're going to do until we kind of know what you want to do. We're interconnected here in a way that that requires we're going to have some frequent conversations about these things.
I appreciate that, and you know, your comment about using alternative spaces for the jury selection process, that's been part of our discussion. We're looking, you know, at states across the country. We're looking at federal courts, and you know, some places are looking into trying to do a jury selection in, say, a high school gymnasium or Five Flag Theater, wherever might be. So those are definitely options that we are looking at. They're not ideal, but you know, safety's paramount, and we're going to do it the best way we can. But I would absolutely welcome the opportunity to, I guess, be heard when this is more of kind of a formal agenda item. And so whatever opportunity you can give me would be appreciated. And as I did say, and I you know, that was one of the main reasons I wanted to be heard today, is I know those concerns are out there about traffic coming in. I feel pretty good about, after our discussions just with our local judicial officers and Judge Lekar, I think our latest discussion was Monday. Actually, I had one Tuesday with the magistrates. But I feel pretty good about the fact that come June 1, there's not just going to be a parade of people coming through the door. It is a very soft opening, and I just want to assure the board and anybody from the county that may be concerned, we are doing everything within our power to make sure that the only hearings that we're going to do at the courthouse, at least probably through June, are those where we just do not have another option. The person is requesting to be seen in person, and then that will be the way it's going to be. But I think that people will be surprised at how low we can keep the numbers down in terms of foot traffic past that front door, at least for a while. Jury's starting, that's a game changer, though.
Okay, thank you, Judge Schubat. I think a work session in the near future is something that needs to happen, and I agree that Chris Soder, our maintenance facilities superintendent, and also Shane Backenstedt and as the head of courthouse security would need to be involved in that. So possibly Sheriff Kennedy. And so I think we'll work with Don Sherman and Ed Raber to get that on the future agenda here.
Thank you.
Okay, thank you. All right, we are in reopening update. Dawn, do you have anything to offer here?
Yes, if you wouldn't mind. I am sharing the reopening survey that was sent out to elected officials, department heads, and our partners at the court system. And so I guess I was looking for a little bit more guidance from the Board of Health with their messaging. Like I stated before, we want to keep consistent with that message. But in order to continue our reopening process, and what I mean by that is signage, helping departments determine if they need any modifications to workspaces, if we are going to need someone to take temperatures and pass out masks at the front door. You know, those are some decisions that we want to bring to the board when they're considering our current restrictions of public access to these buildings. And we just want to ensure that we are in step with the Board of Health. So This one may be a little bit more delayed, maybe a discussion until next week, as the Board of Health has time to meet and really kind of figure out what that message is going to be. But as you can see, there is what I would call strong consensus that the use of mask in the building by the public, that we make that mandatory. I did speak with Tom Berger this morning. He said that they do have 50,000 masks available and that we would be able to access those if we were to make it mandatory, that we would be able to hand those out. So we have that the supply would be there for us to access, at least in the short term. And then we also have staff working on some different options for temperatures. Obviously, we have the contactless ones in the building right now, but if we're bringing in now hundreds of people into our facilities, that may not be an efficient option. So we have some staff working on that if that's something you would want us to do, that we would have that in place to implement. So again, I'm not sure if we want, how much discussion we want to have, because the decisions that we're going to be asking the board to make, we would like to see consistent with the Board of Health message and the county message.
Dawn and McDonough, when you talk about the masks, I mean, we have provided masks, fabric masks for every county employee, correct?
We had the fabric mask. I know we had over 200 delivered. Actually, it was probably more closer to 400. So we did offer that out, and we continue to have those available.
Right. So we can have the expectation as a board that the employees will come when recalled and when in the building. They will come with the mask that we have provided. We're not giving them additional disposable masks, correct?
We only gave out the fabric mask upon request, so not everybody, every single employee has been issued one. But I believe, and Chris may be on, I think he still has a supply of them in which we would be able to do that. My conversation.
Right. He indicates he has 2,000 on site. I don't, if they're fabric or disposable.
This is Chris. There are 2,000 I have on site are the disposables. We still have approximately 200 of the cloth masks still available right now for additional, if staff needs them as they decide to come back. We can make arrangements to get them to them ahead of time, or basically they can make a call and meet one of us out back to pick up masks before they come in, or whatever they decide to do for those.
I guess that goes to my point of, as an employer, what are we doing for our staff? I think we've risen to that challenge and we provided masks. So I'm not sure we need to go to our PPE stockpile to provide for our employees. I would like to see us using something that's, reusable. Apparently John Murphy doesn't like the cloth masks. They're difficult to use. He wants disposable masks for everybody. So I guess we're going to have to go into our thousands and thousands. If we're not going to use the fabric masks, we should at least make them available. I got email this morning from a citizen wondering where they might be able to get a fabric mask. Good conversations.
This is Shane Backenstein. I don't know if everybody can hear me. I just had a couple comments too. Just in regards to the masks and the temperatures and some of those things. Obviously, it's been discussed when we had the kind of the department head in the judicial meeting here a week or so ago. But that's something that's going to have to be obviously looked at, is who's going to be doing that. Once we also get into the social distancing and we get into these courtrooms, the enforcement aspects from hallways to individual offices, the potential strains or the manpower of the security enforcing a lot of these things would be difficult if you were going to mandate everyone in the building to be wearing a mask outside of employees. There also would become the issue if you do get somebody that comes in, takes it off, says, I don't want to put it on. Are we prepared to potentially have someone arrested for not wearing a mask in the courthouse if we strongly recommend wearing them and hand them out at the door, or if you truly are going to mandate them, something that just has to be considered. I have talked with a few people as well. The big issue seems to be still concern from employees in interaction with citizens that will be coming in. Obviously, the courts have been pushed back and have to open come June 1. My recommendation that I brought up in that meeting, and I would still push for this, would be that the county look to at least give another week or two maintaining its same protocol where we are in essence closed to the public. The offices are, as all the county offices seem to be operating fine, functioning well, everything is getting accomplished. It needs to be, even though the public has not been able to access. That would also allow us a little bit of time to try and figure out our entrance protocol, what is going to work for us, what isn't. There's obviously going to be significant delay for people coming in, as we are also going to have to social distance people coming in, clean tubs after uses, separate people as they're getting dressed. We can't just have the mass, even if it's 6, 7, 8 people all waiting to come in at once. It's not going to happen. There's going to be a significant delay between each person. So there's just some other things, logistics, we're going to have to work out as well.
Okay, do we have any questions for Shane?
No, not for me.
Does anybody, is this survey for informational purposes?
Yes. Again, I think it'll be more next week when we are going to look for some guidance from you as the Board of Supervisors of how you would like us to prepare for reopening with the mask. It's the most important thing we see is the communication of what that is, what the requirements will be. Like Supervisor Rookham say, are we going to say we're open, come on in? Are we going to continue to encourage customers to use alternate service options of online pay or mail? So this is to help you have an understanding of where the elected officials, department heads, and our courts representatives are at on some of these issues.
Well, it looks like from the survey, about 80% of our folks want the public to wear a mask, but it almost turns around when it comes to them wearing a mask. So I think we need to have more discussion about this. So I think a work session is in order, and when, you know, I think we need to put it out there for discussion. I think surveys are great, but there's a you know, certain amount of anonymity involved, and I think we need to have a frank discussion on, you know, are we, what do we expect from the public? But just as important, what does the public expect from us, the public servants? So I think we need to address that.
Dawn, I'll follow up on something I requested earlier, which is from each of our departments, a written identification of what are their plans? What do they intend to do? We have elected officials. Could they please describe what they intend to do for their offices? Some of these decisions are ours and some of them are theirs. So, you know, I'd like to see that collected so I know specifically who's doing what in the courthouse. Would be helpful to know. In addition to our outlying buildings, I see Brian Preston is here with us for conservation, but it would be good to know, you know, in some kind of written report, what he intends to do for the management of the county facilities.
We did discuss that, Supervisor McDonough, at our meeting on Friday, that was what we understood the board would like to have as well. So I had asked them to start preparing some of those. So I anticipate another meeting by the end of this week, and we'll stress that and encourage those to be, and if we can include what we have in next week on Tuesday's work session.
Okay. So I guess there's, I think it's to do with reopening, but also for our next meetings, we need to discuss our schedule, but our Denise Dolan, our county auditor, has asked about, you know, when access to county offices does occur, will the Board of Supervisors return to having in-person meetings in our boardroom? That's a fair question. And then there's other issues, I think, that such as, the GDDC had put out a guidance document, that we should be looking at that. That shouldn't be sitting on the shelf. So I think at a work session, we need to go through that and make sure that the department heads and elected officials are aware of that as well. So
something else, Dawn, I would ask that you do, and I'll say this to you with my colleagues present, but I would like to have you look at employees who are on a leave status that they are not actually performing any duties for the county. I would like to have you looking at those with their department heads or to whom they report and start to look at what their duties might be and what they can, is their job been eliminated by the pandemic? It's a tough conversation to have, but I'm not interested in laying anybody off. But I don't even know what the status is of all of our employees, and we've been issuing blanket continuations, and I think this is a time where I would like to be informed, and it can be informally, but of the status of those individuals who are off on leave and have not been doing full-time work, or maybe any work for the county.
Supervisor, I'll include that as part of our work session as well on Tuesday.
Thank you.
Okay, is there anything else under reopening update? I think we need a more formal, extensive work session to fine tune this and with a lot more input. Okay, so the last thing is our next meeting. Next Tuesday, it happens to be our evening meeting, which is 5:30 p.m. My understanding is the only work session we have would be with Anthony Bargett, our county engineer, at 4:30
That is correct.
p.m. So do we want to continue with a 10 a.m. meeting on Tuesday for the COVID-19 issue? We have had one evening meeting last month after our regular board meeting. That might be an option as well. Dawn thinks we could schedule that for 6:15 p.m. and that might give folks who aren't able to participate because they're working during the day the opportunity to, be involved in an evening meeting. So something to consider. I'll put that out there for my fellow board members. And if
so, Tuesday's a night meeting. Is that right? Tuesday's a 5:30 start.
Yes.
Okay, so I would think that would take care of your night meeting on Tuesday. I wouldn't necessarily turn around and meet again on Wednesday at 10. So I think it's helpful to meet with the Board of Health. So I don't know when their schedule is next week. Do we know that?
I guess as chair, I'm going to suggest that we schedule a 6:15 p.m. meeting and then see if that works for Chair Beshen and the Board of Health.
This is Tom Beshen. That would work for me, and I think it would give the opportunity for a few of our members who work during the day to participate. A few more of our members, excuse me.
Okay, Tom, thank you for that. And I also think it might give more family members who have loved ones in our long-term care facilities the opportunity to participate in our meeting as well.
And then as far as earlier in the day, I would expect we'll have several other work sessions with issues that are arising along the capital projects we need to be looking at so that we can be addressing the sheriff's request to look at a remodel. That is a time issue. So we're going to need to get that on the agenda, as well as status update on the now urgently needed courtroom. So there are some things that we're going to have to be able to have some work session time on Tuesday to learn about it in greater detail.
Okay, I would suggest that Ann and then Jay, and of course myself, if we have any specific requests that we get with Dawn and make sure those get scheduled. So, and just for the public, any one supervisor can ask for a work session, and so that I guess after this meeting, that would be appropriate, certainly, to do that. So Jay brought up a good point. I think if we're meeting Tuesday night, I think it would be meeting for the sake of meeting to meet again Wednesday morning. The question would be, do we want to, for next week, only go to just have the one meeting on Tuesday evening and then come back the following Monday? Or do we want to reschedule for a Thursday or Friday for next week? I think again, if there's no other input, I think I'll just, because of the holiday, I think I would just put out there that we would meet Tuesday night and then go to the following Monday. And then if there's a need to do a special meeting or emergency meeting, the chair would not hesitate to do that, to call that meeting.
I'm comfortable with that.
I have a conflict with the 28th on Thursday. There's the governing board meeting.
Yeah,
That's
I
next
think at this
Thursday.
point, you know, I think we would go to, no, I'm talking about going to the following Monday, June 1st. And just then get back on our Monday, Wednesday routine until we decide, you know, that we want to change that. But I think because of the holiday, I think we'll be fine meeting on Tuesday night. So Tuesday at 6:15. So Chair Beshan, that you'll notify your members of that, and then the Dubuque County Board of Supervisors meeting will be at 5:30, and work sessions will precede the 5:30 meeting. Okay. Any other input, questions? I think motion to adjourn would be in order because next meeting would be our regularly scheduled meeting.
So moved.
So motion to adjourn and seconded. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Thank you.
Goodbye.
This is saying update available. It kind of pops up every time I go out. Does yours do that? So should I click it? Okay.